I want to update you on where Arizona is in its current situation, where our numbers are, and the action steps we intend to take going forward. I want to begin by just again saying thank you to all of our nurses, doctors, emergency medical responders, and healthcare workers, everyone that works in healthcare or in a hospital. They are on the front lines, they are in the thick of it, and they have our undying gratitude. I'm also going to talk about some things that we can do today that will help them, help relieve the heavy burden that they have at this moment. I also want to emphasize that you are safer at home at this time in Arizona. We're going to see some evidence today that people have actually been listening to this message over the last 10 days, and I want to thank the press in advance. You helped us communicate that message. People are understanding it, and I'm going to ask you to continue to help amplify that message in the reporting around COVID-19, that people are safer at home, and if they don't have any place to go, stay home. These are the latest numbers in Arizona: 108,614 total COVID-19 cases. On July 5th, we surpassed the 100,000 number mark. We have had a brutal June in Arizona with a 50% increase. And of course, our thoughts and prayers and sympathies go out to everyone that has been affected by COVID-19, which is basically everyone in our state, but none more so than the 2,038 families that have lost an Arizonan. These numbers are going to show where we are and also where we're making some progress and what our opportunities are in Arizona right now. Our COVID-like illness continues to increase inside of emergency rooms. COVID patient use is up, and so is the percentage of positive tests. So we see increases across the board. I'm going to take you through the metrics quickly. I think you've heard some people incorrectly say that this is like the flu. If you look at the gold line, that is the flu, that's influenza. It's behaving like the flu does. COVID is different, and it is on the rise in Arizona in terms of surveillance. I do want to point out that if you look at what has happened over the last week, we see our first flattening and slight decrease. These are our COVID-19 cases by day. A lot of information on this chart, but I want to point out a new metric that we added. That's when the stay-at-home order ended. So if you think back to the beginning, and we've all been dealing with the coronavirus for some time, the emergency order was put on March 11th. Our stay-at-home order ended on May 15th. If you look along the way, we never had much of a rise in cases. After the stay-at-home order, we had a couple of weeks where there was not much of a rise in cases, and then you see a rapid increase in cases throughout June. These are our percentage of positive tests. The blue is the amount of tests, so an ever-increasing amount of tests, and we need more. I'll talk about that. Again, look at when the stay-at-home order ended. You could see that we had weeks of decreasing positivity in our tests, and what we have had since are continuing weeks of increasing positivity. So our positivity is way too high. We are testing sick, symptomatic, and people that have been exposed to COVID-19. So we expect positivity, but this positivity is too high. What it means is that the virus is widespread, and the more activity that is happening in our economy, the more the spread will continue. Again, validation that you are safer at home. This shows you where we are in terms of hospital beds rising. What I think is the line to look at are the orange bars. That's inpatient for COVID, and that's also increasing. Same with intensive care unit hospital beds for COVID-19, an increase in COVID-19 usage. I want you to know that these numbers, while they do show availability, they show hospital beds and ICU beds, they do not show surge capacity that we have. This is in our current hospital system and infrastructure. This is ventilators. It's a rising number of ventilators, and people in the most need these ventilators, and that is increasing as well. This is our testing by day. You can see an ever-increasing amount of testing. This is the same numbers, but we're showing it in a different way. You can see the surge by the height of the testing. That's on the weekends, and then you see the decrease during the weeks. Over 841,000 tests have been completed in the state of Arizona. 418,000 in terms of diagnostic, and 188,000 plus in terms of serology. I think everyone's become familiar with those terms. One tells you if you've had the virus and since recovered. The PCR test tells you if you're sick today. We've taken recent actions to slow the spread, which is necessary in the state of Arizona. 10 days ago, we prohibited large gatherings. I want to thank our local leadership, mayors and county supervisors, for the local mask ordinances and the cooperation of Arizonans in following those mask ordinances. They make a difference in slowing the virus. We paused operations on gyms, bars, nightclubs, water parks, and tubing, and delayed the first day of school. And by and large, we've seen compliance. There have been outliers, but by and large, compliance across the board. So let's track the results. Are these decisions, are these actions having an effect in Arizona? And let's look where we are today. One thing I talked about 10 days ago was the R0 number. That's the average number of people who become infected by an infectious person. It's a way that epidemiologists measure how quickly the virus is spreading. 10 days ago, on June 29th, our R0 in Arizona was 1.18. And if you look, I think on your screen, it would be the far left. I want you to also see that Nevada was in a position with the highest R0. You want your R0 to be below 1. That's the objective. Arizona was at 1.18, and Nevada at that time had the highest in the nation. 10 days later, Arizona's at 1.1. Yesterday, we were actually at 1.08. Okay, so we had reduced it 10 basis points as of yesterday. Today, it's up 2 basis points. So dramatic movement in 10 days and over the 10 days that were the 4th of July weekend, a time when probably many people found it difficult to restrict activity or to stay home. But I want people to know that their actions and their decisions can affect the spread of this disease. And let's take a look at where Arizona is in comparison to others that are out there. The reason I called out Nevada was 10 days ago, they were at the far left side of the graph. They've made dramatic progress in the last 10 days. I talked to the governor of Nevada yesterday, comparing notes on actions and decisions that we were making. We both want to work as hard as we can to get this number below 1. It will mean that the virus is truly spreading and reducing And you can see where some other folks are on the line. If you go to //rt.live, that's the website at the bottom left of the page, you can see where every state is and drill in specifically on Arizona. But the goal here is to be less than one. And the decisions that we're making are to slow the spread of this virus so that we can protect the most vulnerable, so that we can care for people, and the best way to do it is not get it and not spread it. Let's take a look at some information and data on Arizona. Now, this is how the number of cases have changed over the last week. To simplify this chart, red and the more dark red, or bright red, I should say, are hot spots. Orange is also rising, but less so. Where you see blue, it's decreasing, and where you see yellow, it's stabilizing. This is something that we track. It shows us where hot spots are in the state. We are seeing some stabilization, but we need to see a decline across the state. If there was a takeaway on this graph or chart, in addition that we have made some progress in the last 7 days, it's that no county in Arizona, no matter how rural or how sparsely populated, has been spared. Of course, different counties have been in a different situation, but this has affected every county, all 15 in Arizona. Now let's look at the newly reported cases by day in the state of Arizona. And you heard me talk about the stay-at-home order ending in May. And if you look at this graph, you can see where mid-May is and where our number of cases are. The stay-at-home order was lifted on May 15th. And for 2 weeks following that, we were flat. And then there was a rapid rise of these cases in June. Now, I want to point you to 10 days ago when we put these actions of shutting down bars and gyms and tubing and other things. You see a flattening. You see a plateau and even a day or two of decrease in cases. This is encouraging. It's encouraging that the actions can have a result and further actions can have a greater result. So try to hold this graph as you can, if you can, in your mind's eye and see that in Arizona, our rapid increase was in June. And let's compare that to the nation. In the United States, we were seeing a decrease through May and through June, when Arizona was seeing its rapid increase. What you see for the country in July is a rapid spiking and increase of these cases. It's possible that Arizona was the front of that wave of increases in these cases, and the actions that we're taking can lead the way for our state to navigate forward. And you don't have to take it from me. I want you to take it from Dr. Deborah Birx, who was in Arizona last week. Arizona does have 3 counties that we're tracking very closely, the largest one being Phoenix and Maricopa County. The 7-day average is showing some flattening, and we find that encouraging. We're hoping that it heralds a stability in Arizona that at least plateaus their curve. I just got off a conference call with Dr. Birx and Dr. Christ at 1:30 today. I want to thank Dr. Birx for the time that she spent in Arizona. I want to thank her for what she shared on the model that she's working of and the actions that we're going to take today. She found encouraging as well. I also want people to know that I hear the criticism, and I know that there are differing opinions out there. on how Arizona has handled this virus. And I want to make a commitment to the people of Arizona. My decisions are not going to be influenced by any attempt to please the press, and they will not be influenced by politics in any way. Everything we will do going forward will be to protect and promote public health in Arizona. I've talked about protecting lives and protecting livelihoods. And when in doubt, we will err on the side of protecting lives and proceed with caution. So let's look over the last 2 weeks how the cases have changed in Arizona and across the country. And again, the more color, the more trouble. The more bright red or fire engine red, the more dire the circumstances. Over the last 2 weeks, Arizona's map looks a lot different than it did 3 weeks ago. So we are seeing some better results. We need to see more, but the actions that we took 10 days ago are making a difference. We need to increase this difference. One thing Dr. Birx said is that we should think of this in terms of getting out of the zone that we're in right now as a 2 to 4 week event. Okay, so this idea of really pressing, this idea of striking a message that you're safer at home, this idea of finding all kinds of excuses to stay at home, is a 2 to 4 week event, and we'll continue to measure the progress and make decisions as necessary. Now, across the nation, 45 states are seeing an increase in COVID-19 cases over the last 2 weeks. The virus is spreading, and of course, we know that it's spreading in Arizona. COVID-19 remains widespread in the United States. Cases are rising nationwide, and no state is spared. So the decisions that I am going to make are going to be reflective of Arizona and Arizona exclusively. And of course, I take into account other decisions that folks have made, best practices, information that they would have. In addition to Governor Sisolak, yesterday I had a discussion with Charlie Baker in Massachusetts, Larry Hogan in Maryland. So there's a lot of discussion on folks that were hit first, hit harder than we were, and before we were, things that we can do to get our arms around the crisis as quickly as possible. So there are continued sacrifices that are needed. Someone sent me a meme a few days ago, and it showed a bunch of infantrymen storming Normandy Beach. And it basically said, our grandfathers stormed Normandy to defeat the Nazis. We're asking you to stay home on the couch and watch Netflix. Don't screw it up. So it was a momentary, funny issue in a time of real seriousness. But there really is nothing that you can do that will help more than staying home. This idea of sacrificing is really a mindset. And if you see it as helping other Arizonans, helping our state, helping our country, helping our healthcare workers, putting our kids in a position where eventually they can return to school and that we can protect the maximum amount of people and protect the maximum amount of livelihoods. There are strength in numbers along with the informed actions that we can take. So let's talk about the additional actions that we're going to take to slow the spread. And like I said, I hear the differing opinions and listen. and listen to the criticism as well. These decisions have not been made willy-nilly. These decisions have been targeted at large group gatherings and places of higher risk. And you can see this chart. This is our chart here in Arizona, but you could see a similar chart in other states. You could see a similar chart in Texas or on the CDC's website. And this is where our focus is. This is a process of risk reduction. The virus is widespread. There's not the opportunity today to talk about risk removal. It's about making the best decision possible to reduce your risk of contracting this virus, to reduce your risk of spreading the virus, and especially of spreading the virus to someone that's most vulnerable. Today, there's a new executive order that will limit indoor dining to less than 50% occupancy. Occupancy is set by the fire code. Going forward, it will be at less than 50% of that number. Some restaurants have chosen to voluntarily close. It is actually safer, if you look at the risk profiles, to eat outside. And there are many beautiful parts in our state where you can more safely do that. The objective here is, if you are going to eat inside, to make sure there are as few people as possible inside that establishment. So you're safer at home. If you're not at home, you're safer outside. If you're not outside and you are going to go inside, you want to be in places where you can limit the number of people. This executive order is going into effect in consultation with the restaurant industry. We had discussions with leaders and influencers in the industry, and I want to thank them for their input and eagerness to do the right thing. I also want to say, as you look at that chart around reducing risk and the idea of risk reduction, we are going to continue strengthening guidance in the state of Arizona. I know most of the folks in here that have worked with me over the last 6 years know my love of free enterprise and free markets and Adam Smith. In a pandemic, in an effort to protect lives and to protect livelihoods, to have some balance out there in our economy that allows it to operate, we will be more prescriptive in our guidance going forward. And we will ensure and work with others around enforcement and accountability in all our industries. And I want the leaders of our industries out there to know that we want to work with them. I am confident on some of the decisions that we've made that we will be able to make decisions in the future that allow different businesses to operate, but they will operate more safely as we navigate through this public health crisis. There's just no other way around it if we want to protect both lives and livelihoods and have some balance and operation in our economy. Also, we are going to dramatically expand testing in Arizona. I want to thank President Trump and Vice President Pence for their attention to the state, for the resources that we're going to have being brought to the state from FEMA. This is a result of direct conversations between myself, Dr. Christ, Dr. Birx with the Vice President last week. We are launching Project Catapult to dramatically increase testing in Arizona. This is a partnership between Sonora Quest Laboratories and others in the private sector with Arizona Department of Health Services. This will be an exponential increase in tests and processing tests. We will be at 35,000 tests by the end of July, 60,000 tests per day by the end of August, and we will have increased lab processing capacity, which will give us results much more quickly. So you saw where we are in positivity today in Arizona, and we are testing sick, symptomatic, and people that have been exposed to COVID-19. I also want to remind you that we had weeks in May and June where we actually didn't hit capacity of testing because we didn't have the demand for testing. Today, demand is through the roof. And I know that people not only that are sick or symptomatic or have been exposed, that everyone wants to get a test. And we want you to be able to get a test. We believe working with these private sector partners with this dramatic increase in tests, we'll be able to broadly expand our testing this month and next month to achieve those objectives. And that also gives us information of who is sick in real time when they were asymptomatic or didn't think that they had it. And then they can quarantine for 2 weeks, and again, it goes to reduce the spread. We're also going to expand testing in partnership with the Centers for Disease Control and partner with Health and Human Services to offer free COVID-19 testing, up to 5,000 tests per day. Our focus is going to be Maryvale and South Phoenix with 12 days of surge testing, and I believe Major General McGuire is going to comment more on the specifics of this, but we're hopeful to start this next week in Arizona. I also want to thank our university partners, and today specifically Arizona State and Dr. Michael Crow. The Department of Health Services is going to partner with ASU on a free saliva-based COVID-19 testing, painless. All you do is spit into a capsule and the test is done with saliva. There's no need to pre-register for an appointment. It's free. The first drive-through will be Saturday, July 11th in the West Valley. We're going to add additional sites and days, and this will be ongoing over the next couple of months. So thank you to the researchers and developers at the university, and this testing begins on Saturday. We're seeing some progress in Arizona. We need to see more. We simply can't let up. If we will stay at home, if we will make safer decisions, if you need to do something and you go out and do it and go home, and we keep pressing, this is a good excuse to whatever series your friends have talked about on Netflix, to watch it or rewatch it, or pick up your reading habit again. But any excuse you can find to stay home will benefit the state of Arizona, will help us navigate through this, and I appreciate people for what they've done the last 10 days over the Independence Day holiday. If we can do that again over the next 2 weeks, we can be in a much different position than we are today and actually seeing a decrease in the spread of this virus. In addition to staying home, the things that you can do that make the biggest difference are to wear a mask. And I want to ask everyone to please wear a mask. Do it for your neighbor. Do it for your grandmother and grandfather. Do it for the nurses and the doctors and the healthcare workers. There is no better way to lighten their load than to put on a mask and slow the spread of this virus. And in addition, of course, this idea of physically distancing, washing your hands, and staying at home, and if sick, of course, staying at home can all make a difference. We're going to be living with this virus for the foreseeable future. And while I think Arizona's time of maximum challenge is right now, we don't know what the future holds. And we do know, as we get through summer, we head into flu season, which brings a whole different set of complications, which we will be talking about in future press conferences. But the best way to reduce the flu in Arizona is physical distancing, washing your hands. And when you can stay home, stay home. And of course, at this time, and while COVID-19 is in our midst, wear a mask.